I'm Michelle Malchiotti. I'm a certified athletic trainer, and today we're going to go over a knee evaluation. So the first thing I want to do is make sure that my athlete is positioned correctly. They're going to be lying supine on a table, completely flat. Make sure that they have shorts on so that the entire knee is exposed. When you're testing the ligaments of the knee, you always want to start by testing the unaffected leg first. So the first thing I would do is go through all of the tests that I'm about to test on the injured leg to the non-injured leg, and make sure that I have something to compare it to. So we're going to say that on this athlete, her left leg is her injured leg. So we're going to start out with an anterior and posterior drawer test. This is to test the anterior cruciate ligament and the posterior cruciate ligament. So I'm going to bend the athlete's knee up to 90 degrees, making sure that the entire sole of the foot is flat on the table. I like to just sort of sit on the foot a little bit, just to kind of make sure that it doesn't shift or slide around on the table. I'm going to place my fingers behind the knee, kind of making sure that the hamstring ligaments are nice and loose. Sometimes athletes will get a little bit tense here, so I want to make sure that the patient is totally relaxed. Place my fingers sort of at the bases of my thumbs on the tibial plateau, and I'm going to pull the tibia forward. Pulling like this. Give it a good pull, making sure that there is no loose or springy end feel there, that end feel is nice and tight. And then I'm going to push, doing the same thing, pushing, checking the same thing, making sure that that end feel feels nice and tight and there's no elasticity. Then to check for the medial collateral ligament, I'm going to do a valgus stress test. So I'm going to hold the patient's leg, one hand stabilizing the lower leg at the ankle, the other hand at the lateral aspect of the knee. I'm going to bend the knee to about 30 degrees, kind of bringing it up and forth a few times like this just to make sure that patient's nice and relaxed. And then I'm going to apply a valgus stress to the knee, looking for that opening up of the knee joint right there. Then I'm going to do the same test at 0 degrees. So I'm just going to let the knee drop just like that. And again, same thing, applying a valgus force, looking for that knee to open up at all. Then to test the lateral collateral ligament, I'm just going to switch sides. So now I'm using my other hand to stabilize the leg at the just above the ankle. I have my hand at the medial aspect of the knee. I'm going to kind of bend that knee up and down a few times, making sure that's nice and loose, hamstrings aren't tight, applying a varus force, seeing if I can get that knee to open up just a little bit, not at all, nice and tight, and then at 0 degrees. So just let that knee drop, apply that force, and see if I can get the knee to open up at all, which I can't. Another test for the anterior cruciate ligament is called a Lachman's test. So in this test, patient again is lying supine on a table. You're going to stabilize the femur a few inches above the knee with one hand. Grab the tibia just a little bit below the tibial tuberosity with the other hand, and I'm trying to create a shifting at that tibiofemoral joint, pulling forward, not getting anything here. So that feels nice and tight.
Thanks for watching this video. Do you want to learn more or become certified in this skill? Just visit us at SimRated.com. Be sure to check out our other videos.